Welcome to Aging Better in Uncertain Times. I'm Gord Martineau in studio alongside Dr. Fabio Varlese. Here we help you keep informed and up to date on the latest in science, medicine, and technology that helps us all age better in these uncertain times.
When I was training, LOL meant little old lady, right? If you were 80 years old or 85, the medical history stopped there. Nobody was going to look at 85 years old. Okay, done. But now, people are living longer and in better health. And I operate on 90-year-olds. I've done surgeries on 97-year-olds who are living independently and driving. And this concept of ageism is one that we really have to tackle because we could really make a big difference in the quality of life of people that have already produced many wonderful years for our country and for other people's lives. And that's really the most rewarding part.
Thanks for joining us today on our weekly guide into living a better, healthier life so we can all experience aging better in these uncertain times. Now, throughout the series, we're going to examine the best ways to prepare ourselves for the future. So, what's the best advice for overall health? We're going to look at every aspect affecting your life. That means physical, mental, financial, nutritional, and medical. We'll cover all the bases. To do that, we're going to supply you with high-value information from the leading experts in each field. And by that, I don't mean just everyday opinions. We're going to have to introduce you to the leading experts in each field. These are men and women who have studied, worked, and who teach at the highest levels. You have the questions, we have the answers. Joining me here in the studio, Dr. Fabio Varlese, a specialist in internal medicine and geriatric medicine. He's the Vice President of Medical Affairs and Chief of Staff at Runnymede Hospital, Staff Specialist at Baycrest Health Sciences, and Dr. Varlese, also an Assistant Professor at the University of Toronto. Welcome, Doctor. And also with us today is Dr. Giuseppe Papia. He is a member of the Division of Cardiac and Vascular Surgery and the Division of Critical Care Medicine at Sunnybrook Health Sciences Center. And thank you very much for joining us today, Dr. Papia. We'll get to you in a second, but first, Fabio, heart health, enormously important. Is one of the first questions you ask a patient when they come to you, no matter what the procedure they require, what medical care they need, do you ask them right off the top, how's your heart? What kind of shape is your heart in?
Well, we ask them that question through the types of symptoms that they may have. We ask that question through potential risk factors that they may have. We look at their histories. We do a very, very comprehensive assessment. It's one of the most important topics because heart disease is usually an indication that there could be other organs involved, anywhere from the brain to the kidneys, and so it is certainly central in the comprehensive assessment that we perform on patients. Mm-hmm. I mean, it's so important that to talk about it because, heart disease together with cancer, accounts for almost half of all deaths in Canada. And that's, and then, number 3 is accidents, injuries. But, and then men are 2 times more likely to suffer a heart attack than women, and a diagnosis of coronary artery disease is made 10 years earlier than women. So a lot of implications with heart disease and how other organs are implicated. So very important.
Dr. Papia, heart health and immunity go hand in hand, wouldn't you say? I mean, at people, when they reach a certain age or as they approach senior citizenship, that heart it becomes the number one concern. And so immunity goes hand in hand with it, does it not?
I think they're definitely related. I think that you can't take the disease out of the context of the patient. I mean, we always made the joke in medical school that if you wanted a long life, you had to pick your parents well. And unfortunately, none of us had that luxury. So how your genes interact with the world and your lifestyle make a big difference. And what you do with your lifestyle affects your immunity. And inflammation and atherosclerosis are the same process. So when your arteries get hard and diseased and narrow and close up, that's an inflammatory process. And you definitely have immune factors that are related with that.
Would it be fair to say, in my assessment or opinion, that the 2 most important factors in your overall health are your brain and your heart? I mean, because if your heart is in poor shape, the rest of your body is going to be in poor shape, right?
Yeah, I think that would be a pretty fair assessment. I think that without a heart, there is no person. The heart, it pumps everything everywhere, in nutrition, oxygen, everything you need for life to get going. And then without a central processing unit, without your brain and keeping your brain healthy, then you're not there either. So I completely agree with that.
So nutrition, lifestyle, big factors in treating people with heart issues. I mean, how do you lecture people without, browbeating them into taking care of their heart?
Oh, I think that's a great question. There's no browbeating and no lecturing. There's nothing I tell patients when they come to me that they don't already know, and they don't cringe when I tell them. I treat a lifestyle problem, vascular disease. I'm a vascular surgeon, and a lot of that is lifestyle. And, they need to eat better and quit smoking. And they know that. In fact, I think that sometimes the most unhelpful thing I tell people is to quit smoking, because what they need to hear is how. They all know that they have to quit smoking.
Yeah.
What they need to know is how. It's kind of like when you tell a marathon runner, if you want to win the race, you have to arrive first. That's not helpful information to them. They need to know how. And I think that that's where you engage the patient. And if you tell them just to quit, get better, exercise, and leave, they actually kind of hate you for it.
Well, but and the thing is, you probably get bored telling people the same thing over and over and over again. People should know this, but you have to read the Riot Act anyway, don't you?
Yeah, and I think that my approach has changed over the years. I think the Riot Act doesn't work. In fact, the moment I start telling people to live healthier and to quit smoking, is they shut off. You see it in their eyes, right, in the clinic room.
Yeah, because they're saying, "Oh, that again." That kind of thing?
It's like, I'll say, it's like when I was a boy going to, family cultural events with my parents. I was very good at turning off. And I think the patients are very good at turning off the moment you start lecturing them. So in fact, I do a little thing. I just tell them, look, I'm going to give you a useless piece of information. You have to quit smoking. And I know that's not helpful. And then all of a sudden they look and they say, well, what do you mean? And I'll say, well, because you've probably quit so many times, you think it's easy to quit. You've done it 20 times, so quitting is easy. But staying off cigarettes or getting exercise, these are difficult things if you try to tackle them all, with big goals. So, I think that information has to be tailored to the individual patient, or it's just not going to be helpful. And acknowledging how tough it is, I think, engages them.
Okay, so giving up cigarettes and improving your lifestyle. What about alcohol? How big a factor is that? I mean, do you tell people, hey, you know what, you got to back off on that stuff, or cut it out entirely?
I think that that is a double-edged sword. I think, if you look at all the studies for heart health and for vascular health, small amounts of alcohol has always been protective. And I do not sit and advocate people drink more alcohol. But I do ask them how many drinks they have a day, how many drinks they have a week. And, my basic advice is use your common sense. If you don't drink, don't start. And if you drink a lot, cut it down.
One area I want to get into, and this one for me is pretty interesting, your area of academic interest is in patient safety and quality improvements in perioperative care. Explain to me patient safety and the perioperative care. How significant is that in the treatment of the patients you have?
Well, it's very significant. I think that, so a lot of that work, I've spent probably the better part of my career working on protocols and standardizing care for surgical patients to make their journey in the hospital and back home as safe as possible. And one of the earliest projects I took on was a simple checklist, the surgical safety checklist, that was to be performed before every surgery. And now I'm delighted to say it's mandated in the province of Ontario. I think every hospital is at 100%. And this is a simple checklist, a simple conversation that happens before every operation and every operating room in the province to say, hey, what are we doing today? Do we have our equipment? Are all of the safety measures in place that we need to be in place to make this operation safe for this patient? And then are we ready to proceed? And that has made a huge difference, both in teamwork, and we know that high-performing teams have better outcomes, and in patient safety.
So, with regard to your mission to maintain people's dignity, you also get into the area of possible amputations because people suffer from things like diabetes, which is a very serious situation, and a lot of people may take it lightly, but that's huge, patient dignity, and discussing the issue of maybe you might lose a limb because of your condition.
Absolutely. When I started my practice, diabetes is one of those things people take for granted that people just get when they get older. And what comes hand in hand with diabetes is vascular disease and blocked arteries. What we found is that this problem leads to an enormous amount of avoidable major leg amputations. And if you approach their care quickly and in a multidisciplinary fashion, you're actually able to save their legs. And that's the saving dignity part of it. When patients develop an ulcer on their toe and they have diabetes, they're just written off as a diabetic ulcer, give them some cream. And we know now that the outcome for those patients is worse than the combination of breast cancer, prostate cancer, and colon cancer combined.
How do you mean?
It is a devastating thing that happens to them.
How do you mean the outcome is different? What are you talking about? The loss of a limb?
So it just tells you how sick those patients are. So a patient with diabetes that develops an ulcer has a 75% chance of losing that limb. But actually, statistically, they have a lifespan of less than 55% over 2 years. So most of them are so ill, then that is just they're just not going to be around in 2 years. And that's something that people aren't aware of. Like, this is a devastating thing, not just a little thing you put cream on.
So people often come to you at the point where, and I don't want to say this, but they're in the late stages. I mean, the situation is so dire that there's a limited number of things you can do.
100%. The problem we found, and certainly as we started looking into these patients, is they're older, they have multiple medical problems, and people have kind of said there's not much you can do. But so by the time they come to our center, where we take a very aggressive multidisciplinary approach, both with their medical care, their vascular care, with new techniques that we're developing every day, and their wound care, we're able to keep those limbs on longer and longer and save them from major amputations, which is like a death sentence if you're in your 80s, living alone, to lose a limb.
Dr. Papier, when it comes to surgical procedures, I mean, I've had the benefit, because my background is journalism, of being in the OR and witnessing heart surgeries, for things like tetralogy of Fallot, which, most people don't understand or wouldn't unless they researched it. But are there just a limited number of surgeries you can do for people with heart ailments, or are there new developments coming along as we speak?
Certainly, there are always new developments, and we're trying to get further, bigger, but with smaller incisions and even no incision. So, with regards to the heart, rerouting electrical problems with small needles in electrophysiology labs, putting in valves through small or no incisions in the leg where people go home the next day, and opening up arteries with clot busting agents for different parts of the artery that weren't available before, not just fresh clots, but things like collagen. And there is a group at Sunnybrook leading this to open up things and really get patients back to a dignified life as quickly as possible with the minimum amount of injury from surgery as possible. The work I do is to use those techniques in the foot. And so where these ulcers develop and they could progress to gangrene and lead to leg amputations, we take these small wires that are 14 thousandths of an inch, but 3 meters long, and we use them as a spear to go down into 1 and 2 millimeter arteries and open them up and get these ulcers to heal. And that stops the gangrene from going on and taking the leg.
How rewarding is it when you see research and new developments coming along, when you say to yourself, wow, that's amazing, this is going to make my job so much easier?
I'm not sure we ever have an easy job,
Yeah.
but the reward comes from the patient. I could tell you that, and I have this discussion with Dr. Varlese because his patients are older and my patients are older, that when I was training, LOL meant little old lady, right? If you were 80 years old, or 85, the medical history stopped there. Nobody was going to look at 85 years old. Okay, done. But now, people are living longer and in better health. And I operate on 90-year-olds. I've done surgeries on 97-year-olds who are living independently and driving. And this concept of ageism is one that we really have to tackle because we could really make a big difference in the quality of life of people that have already produced many wonderful years for our country and for other people's lives. And that's really the most rewarding part.
And Dr. Varlese, nutrition and lifestyle come into it because, as Dr. Papia was saying, he's operating on people who are older and older. So, heart health is so important because some patients may not be at the point where they can withstand the rigors of surgery and the recuperation.
There's no doubt. In fact, we talk about this all the time with Dr. Papia. In fact, we're looking at a program that is focused on screening and prevention. And I'd love to have Dr. Papia talk about this program because I think that it really looks at, the issues that you're bringing up, Gord. I think that prevention still remains a big issue, and developing programs that focus on screening are certainly going to have a massive impact on the quality of life and aging better. Perhaps, Giuseppe, you can talk about that program.
I'd be happy to. You had asked or mentioned earlier that by the time patients get to me, it's too late, and that's often true. And so we started a awareness campaign called Project Saving Legs. And with this campaign, it's really getting the word out on the scope of the issue and how severe the issue is for these patients. And prevention is really the key. But in prevention, as we mentioned, the patients are older. So really, it's about early detection. And in a multidisciplinary program where patients with diabetes get screened before there's a foot problem by their GPs. And we support them remotely and through specialized programs, and really trying to create this hub and spoke model of specialized centers where patients that have, multiple issues can be supported. So as we mentioned, these patients have medical issues, they're older, mobility issues, they smoke, all of that, and they have vascular disease. All of that has to be tackled at the same time. And if you could think about that concept, we're talking about the equivalent sort of setup like a cancer center. If you in this country are a young woman that feels a breast lump, with one single fax referral within 3 weeks to a major cancer center, you'll see all your specialists, have all your diagnostics, and have all your care taken care of. And we know this saves lives. And so we need to create the same thing for patients with diabetes and vascular disease. And that's the program that Dr. Varlese is talking about. A one-stop center where we could do all the tests, have all the specialists approach the patients at the same time before the issue gets to amputation. If we treat ulcers and get them to heal in patients and prevent amputations, we do a lot of procedures. There's a lot of care, and that costs in Ontario about $7,000 to $13,000 a patient, maybe as high as $20,000 if they need antibiotics and some hospitalized care. If these patients go on and have an amputation, there's this concept that, okay, you eliminate all those procedures. Well, the cost to the system is $70,000 per patient. If we got our rates down with a primary prevention program, we would save hundreds of millions a year, and we would liberate all those inpatient beds for other people that have other medical issues that need inpatient beds. Like it would be capacity creating. So this is the goal, and this is why we're so passionate and strong about it.
So, Dr. Papia, thank you so much. I mean, we could go on for a much lengthier period of time than we have, but unfortunately, we're limited by the number of minutes we can do this. But it's really educational to speak to you today, and we wish you best of luck in your continued work.
It's been a privilege, and I really appreciate the opportunity to participate in this great program.
Great. Thank you very much for your input.
Thank you.
Some final thoughts now with Dr. Varlese's prescription to aging better. So, Dr. Varlese, heart health obviously is hugely important. I mean, that goes without saying. But we've learned that diabetes and the side effects, negative side effects of that, are of particular concern. And from Dr. Papia's point of view, not enough focus is being focused or being paid to the issue of diabetes and the problems that occur as a result of that, specifically amputations.
It's incredible. Diabetes continues to be a major part of the medical care of many of our patients today. We tend to forget that it's very much lifestyle related. And so, as usual, you hear me say this over and over again in these episodes, that there's no doubt that we need to spend more time counseling our patients and coaching them into health. Medical care is making so many changes. There's a lot of progress in the types of surgeries that we perform today, and it was just amazing to hear Dr. Papia talk about some of the latest innovations in surgical care. But more importantly, we need to focus on the prevention that really helps us have an impact on the outcomes. And also, it was amazing to hear about the LEAP program that can, in fact, have a significant impact on the prevention and the screening of patients before they have to endure the type of complications that diabetes leads to.
Education is a huge factor here.
Huge.
Public awareness.
Absolutely.
Yeah. All right. Thanks for that. And as we wrap up today, please, folks, get a flu shot. The information is at myflushot.ca. Questions about aging better can be emailed to info@agingbetter.ca or by visiting our website at agingbetter.ca. Aging Better in Uncertain Times, brought to you by Delos, Runnymede Health, Jewel 88.5, L'Oreal, La Roche-Posay, Vichy, Avicana, and Sanofi Pasteur, in part to an educational grant. Be sure to drop in for your next doctor's visit on Jewel 88.5, Sundays at 8:30 a.m. or at jewel885.com. Until next time, I'm Gord Martineau with Dr. Fabio Varlese, along with producers Dominic Shulo and David Sursta. Be well and stay safe.